And next, I'd like to introduce Dr. Jeff Garderi. So Dr. Jeff is known as America's psychologist. You can find him...
God bless America.
You can find him on a variety of popular news outlets, CNN, MSNBC, Fox News, and a variety of pop media outlets. And he would like us to also know that he does have a day job where he has a faculty appointment at Touro Osteopathic Medical School. The first question that we'd like to pose to our panelists is why did you choose to participate in this event?
Why did I choose to do that? I didn't choose to do this. I was drafted. Pastor Ron and God. And Dr. Adi. And please give them a round of applause. They are just amazing. And a round of applause to the panelists who were here before, because they were the real experts, right? We learn our stuff out of the books. But I decided to do this because, yes, in addition to doing a lot of, ratchet TV and I've actually had many spiritual experiences. I am actually an interfaith minister. I have a doctorate in divinity, and I've started preaching in my therapy sessions. And so, when you start talking about do 5 bouts of CBT and then do Psalm 23 and 91 and call me in the morning, this is the right place to be.
Building on the unique challenges that particular groups and individuals face, Dr. Jeff, in your experience, how do cultural backgrounds or perspectives influence people's approach to mental health? And can you give an example of a time in your clinical work when the contribution of cultural perspectives was successfully addressed and even enhanced the treatment?
What's the last part of that? I'm sorry.
Even enhanced the treatment.
Oh, yes. Okay. So at the Touro College of Osteopathic Medicine, I teach a course called Intro to Cultural Competence. And in that course, we work with first-year medical students around understanding that when there are medical issues, those medical issues may be caused by, they may be maintained by cultural issues. When a person, for example, my parents are from Haiti. How many Haitians in the house? Is that good or bad? It's great. Sac passe. How do Haitians, for example, or Haitian Americans look at illness? They look at it different than perhaps someone who may be more native to the United States, right? I'm not talking about Native Americans, but more native to the United States with regard to within the last generation being born here. And so what we see is that the perception of what illness is has a lot to do with how the person experiences that disease. In Haiti, for example, if someone is experiencing a psychosis, we have to look at whether it's just some sort of a biochemical issue, whether it's some sort of a genetic issue, or whether it's something that a wunga would have to look at. For those who are Haitian, you know what I'm talking about. Is it something that is much more spiritual? Is it something where it may deal with the spirits are involved in that? Whether it's not or is, and one of our panelists talked about that, is not so much for us to discern as clinicians, but to bring in the possibility and open up the dialogue as to what do you think it is? I mean, it's easy for us to tell you what we think it is, but what do you think it is as the patient? How is it that you experience it? Is it something that perhaps you feel has been passed down? Do you think it's a result of some sort of a behavior? Do you think it's some sort of a curse that you're dealing with that has been brought upon you because of something that you have done at some point in your life or that a parent has done. And so by being able to open up that discussion, now we have the cooperation of the patient. Without that cultural sensitivity, without that cultural competence, without knowing what that Haitian background is or asking about any cultural background, then we're not getting the trust of the patient and we're not fully understanding the complexity of whatever that issue is. And if we don't understand the complexity, then how are we going to help solve it? How are we going to bring about self-empowerment? How are we going to negotiate with that patient and say, well, we think you need some therapy. We think you may need some medication. We think you may need exercise, a change of diet, prayer, or maybe bringing in someone to do some sort of a voodoo ceremony, which we have done in the past before to help with some of these issues given to what the person's belief may be. So whether the person is Haitian, South American, Native American, Italian American, whatever the case may be, you must understand where they come from and the importance of the sensitivity and the cultural competence as part of that treatment in order to get a better patient outcome.
Okay, here it is. How effective are creative arts therapies and animal therapies compared to traditional therapy routes? And how can clients advocate for those kinds of therapies and faith-based mental health services to be covered fully by Medicaid, Medicare, workers' comp, other insurance?
We've got to get out of this turf war, like this is mine and this is yours. And when we do that, when I've heard therapists, social workers, psychologists, and so on, look at art therapy, for example, or bringing a pet into therapy and looking down on that as if it's some sort of like side work or something. And we know that a lot of those types of therapies are extremely powerful. So as we respect that more, then those types of therapists will be more empowered to be able to get the reimbursement that they deserve and to give the therapy in that way. But Dr. Barbara, I agree with you. Therapy sometimes can be very dramatic, but sometimes it can be very fun. For example, I sing very badly in my therapy sessions, and it's a lot of fun. Sometimes we pray in therapy sessions. Sometimes we read the Psalms in therapy sessions. Sometimes I'll take the students where we have pets come in every week and encourage them to visit the pets and just, stroke that particular animal just to get them to feel a little bit better. So we have to look at opening this up. Those old days of, harumph and let me just listen to what your problem is and I'll just, do. That stuff doesn't work anymore. Now we have to be much more interactive and look at every means, by any means necessary, in order to help our patients.
As we have talked about starting a conversation with this town hall and this event, you've heard from this panel of experts that the conversation continues once you get in the room with your mental health care provider, your therapist, your psychiatrist, your psychologist. If there are concerns that you want to see addressed, it's about having that conversation. If there's someone across from you who doesn't look like you, it's about having that conversation. If there are other aspects that you would like to bring into the therapy, whether it's creative arts, whether it's your faith, it's about having that conversation. And as we continue this dialogue, we hope that you will find rich and engaging experiences as you continue on your journey with mental health and wellness. Let's say thank you again to our panelists.